Let's take a look at the major structures inside of the oral cavity. The oral cavity is the space inside of the mouth. The roof of the oral cavity is made up of the palate. You can see that the palatine process of the maxillary bones makes up what's known as the hard palate. That's the anterior 2/3 of the palate. And that transitions into a muscular archway known as the soft palate. Taking a look at this view, here's the hard palate. And then the posterior muscular archway is the soft palate. The soft palate gives rise to a soft, fleshy projection on midline called the uvula. And this open archway is known as the fauces. You can imagine if we were miniaturized and standing on the tongue and we walked through this archway of the fauces, deep to that is a region called the oropharynx. Here we can see the palatine tonsils in the oropharynx. The lateral walls of the oral cavity are made up by the cheeks. And then the floor of the oral cavity is occupied by the tongue. The oral cavity contains teeth. Humans have two sets of teeth. We have baby teeth, also known as deciduous teeth or milk teeth, that are temporary. There are 10 teeth per jaw. Those will give rise to the adult teeth or the permanent teeth. There are 16 per jaw of the permanent teeth. And of course, the function of the teeth is to process incoming food. What it does is it breaks it into smaller pieces through chewing. Chewing is known as mastication. And the purpose of mastication is to increase the surface area through which we have for digestive enzymes to work. And so taking a look at the structure of an individual tooth, the portion of the tooth that projects from the gum line is known as the crown. The crown is the portion that's covered by enamel. The portion of the tooth that's deep to the gum line is known as the root. And just to relate this to some structures that you might be familiar with already, the connective tissue that is anchoring the root of the tooth in the socket is known as the periodontal ligament. We can see how the bone builds up into these processes at the top of the socket. These are the alveolar processes. And we can also see, just like the dermal papillae, how within the tooth there's a projection of connective tissue that juts up into the tooth with a blood supply and a nerve supply. Taking a closer look at the tongue contains taste buds, which create the rough surface on the tongue. There are 3 types of taste buds that you want to be familiar with. One type is called the fungiform papillae, and those are kind of the rounded mushroom-shaped tops coating the tongue. The other type of projection that contains taste buds are called the circumvallate or valley papillae. Those are the ones that form a bit of a V shape in the back of the tongue. And then other than that, the tongue is coated with papillae that don't contain taste buds. Those are called the filiform papillae. They just make the tongue a rough surface that is more effective in manipulating food. Taking a closer look at the pharynx, 2 of the 3 regions of the pharynx are part of the GI tract. We know that the nasopharynx is a region that's right behind the nasal cavity. We don't expect food or fluid to travel there, even though it could, and so we don't really include that in the GI tract. The oral cavity is continuous with a region called the oropharynx. So here is the oropharynx. And then the oropharynx is continuous with the region called the laryngopharynx. And the laryngopharynx is the lowest most portion, the inferior most portion of the pharynx that divides into 2 parts, or in other words, it bifurcates into the esophagus posteriorly and the trachea anteriorly. You might recall that the larynx is on top of the trachea, and the superiormost portion of the larynx is the epiglottis, a flexible region made out of elastic cartilage that closes down over top of the larynx to prevent food or fluid from entering when we swallow. And just to take a look at that picture on the left, we can see that the epiglottis is open. Here the person is breathing, talking, something like that. But when the person swallows food or fluid, taking a look at the picture on the right, this green material would be a bolus of food. And you can see how the epiglottis is going to physically prevent that food from entering our airway, the trachea. Automatically, the food will enter the esophagus, which is posterior.